Okay, good morning, everyone. It's Tuesday, the 23rd of June, 2020, and thanks for joining me this morning. So I've got a couple of updates to give you this morning, and feel free to use the chat bar if you've got any questions at all throughout, and I'll keep an eye on that. So the first thing I wanted to update you was about the NICE guidelines on renal transplantation that have just come out a couple of days ago. And although this is more of a secondary care thing, I think it's important for us to be aware that anyone that's having a transplantation and obviously donating or in any position of transplant, they need to be self-isolating 14 days before transplant, including members of their household as well. And so in case any of your patients are on the list that you're aware of, that's what they're being advised. And they'll be contacted directly by the hospital in line with the NICE guidelines as well. So I just thought I'd give you a heads up about that in case there's any information that comes into your practices. The really big update this morning is about steroids in COVID. And so over the last few weeks, we've all been talking about whether it's safe to use steroids in COVID. And actually, those that do joint injections, whether we should start them again or not as we sort of move towards. Now, although the government introduced that we're on level 3, we're still on level 4 in the NHS. So what's really important to recognise is that there's two different levels. One is the government level for the general public, and one is the NHS response level. We are still at level 4 in the NHS, and therefore we still must be very cautious about the way we manage patient care. So there has been some guidance from the Royal Colleges, and it talks about whether we should be giving oral and injected steroids, particularly for some musculoskeletal conditions or rheumatoid conditions or arthritic joint pain. Now, what we know is that actually steroids can be life-saving, and suddenly stopping steroids can absolutely be dangerous. So there's the sort of the fine balance. So the guidance really says is that only give steroid injections, certainly for severe symptoms and where there are no other options. So really what we're saying is don't stop current steroids, but taper their dose where it's clinically safe and what we would normally do in general practice. Think before starting steroids, particularly because we know that steroids can dampen immune responses. Now, we're slightly different when we're talking about dexamethasone, as you probably know. We're mainly talking about prednisolone orally here. Always start on the lowest dose of oral steroids. And generally, if we're starting more than 5 milligrams per day a month, you might need to consider whether that patient needs to go into the shielded group. Now, of course, we all know that that is going to end on the 31st of July. And from the 1st of August, those people are free to go around. And of course, from the 6th of July, they're being told they can meet in social bubbles. Now, when we talk about starting people on 20 milligrams of steroid per day, they should definitely be in the shielded group, and that is in the guidance. So the question is about PMR patients, and what they're saying is don't give more than 15 milligrams of prednisolone for PMR during COVID, and no more than 40 milligrams of prednisolone for GCA, and no more than 60 milligrams if you're really worried about ocular involvement. And no more than 30 milligrams finally for a week if you've really got difficult to control gout where NSAIDs or colchicine hasn't worked or is contraindicated. Now, the question about giving steroid injections into joints, the guidance is that as the NHS moves from a level 4 to a level 3, it's probably quite reasonable to restart intramuscular injections. But again, we should be using our clinical judgment and administering the injections to the highest risks, or those really with significant disease flare-up where it's affecting their ability to function, and obviously make sure we're not using really more than 120 milligrams IM of the methylprednisolone or an equivalent injection. So I think that's a key change really for us to start moving towards business as usual. The next thing I wanted to talk to you about was the principal trial, which a lot of practices have signed up for. This is just a reminder that the principal study aims to find out whether early treatment in community speeds recovery and reduces the need for hospital admission with COVID-like illness. And they're still looking for more practices to sign up. So if you just Googled principal trial, if you wanted to sign up as your practice, there is a payment associated with it. So it might be something you would like to do. This week, I've had a lot of questions about COVID antibody testing, so I'm just going to go through that just quickly. It's still only available for primary care staff. approximately 3,500 primary care staff in NCL will have the test, and approximately 60-something% have had the test so far. And what we're probably seeing is that about 10 to 15% of primary care staff have an antibody present, which is higher than the average population, because what we know is that it's between 5 and 10% of the UK population have an antibody or are likely to have one. So continue testing primary care staff. It is not still available for patients in NCL. However, if you think it's going to change the clinical management of your patient, so say somebody's coming to you and saying they're still breathless some weeks later and you weren't sure whether they had COVID, that would be reasonable to do an antibody test. Now, there's been a lot of questions about what's our indemnity, and there's been a lot of concern regarding that, and particularly the LMC raised a concern. But what we have been able to confirm is that where you perform this activity for your staff in your sort of indemnity insurance arrangement, the clinical negligence scheme for the coronavirus, which is a CNSC, will provide clinical negligence indemnity cover for practices undertaking the blood test for their staff. So that means that this is covered for primary care staff who took blood samples from any NHS primary care contract staff. So it doesn't mean it's necessary from your practice, including colleagues or other NHS employees for the purpose of COVID antibody test. And there's some information on the CNSC website. So absolutely, the good news is that we are covered for this and there is no sort of legal issues there. The next thing I wanted to update you on is about Office 360 and Microsoft Teams. So we've all got really used to Microsoft Teams, and you might have remembered that the deal comes to an end this Friday from Microsoft Teams, because we had a free, bit like when we got a lot of free minutes and free data from mobile networks. Microsoft had provided Teams for free to the NHS. So the good news is that last week on Friday, NHSX, which is NHS Digital, effectively have negotiated a 3-year deal with Microsoft Office 360, which will give all staff access to Microsoft Teams for 3 years. And what they've promised us is that this will be secure enough against any cyber attacks, obviously they hope, and it is a secure mechanism for us to communicate with each other in the practice, and also to contact and speak with patients, because it's a secure thing. So it's really good news that we can have it for 3 years, and that we can also communicate with patients through Microsoft Teams. And we shouldn't be using Zoom as the platform, because there are a number of security issues with that. So it might be that you start moving to different ways of working. I know that a lot of us are using AccuRx as well, which is a platform that's being looked at again in the NHS to see whether it can be continued and funded. But certainly we know for the next 3 years we've got Microsoft Teams, so that's really great news. So I'm going to pause there and see if anyone's got any questions. So if anyone wants to pop anything in the chat bar, or anyone wants to ask me anything, please feel free to. If there are any questions that you think about after the webinar, just pop them into the chat bar. I can still access them and I'll answer them on Friday or through the chat bar as well. So nice and short this morning. There's not too many changes since Friday. And I will see you all on Friday unless anyone's got anything they want to ask me. Okay, everyone, I'll see you all on Friday. Have a great week. Go ahead. Is that someone?
Thanks, Nick.
Thank you, everyone. I'll see you all on Friday.
Thanks, Nick.
Take care. Bye.
Thank you.